Good morning, everyone. If you'd like to take a seat, please. It's so good to see you all here today. I'm Teresa Wukasik. I'm the Executive Director of the HealthPath Foundation of Ohio. I see a lot of familiar faces from folks that I've worked with in the past, so great to reconnect with you. And for those of you that I have not met, I look forward to having a chance to talk with you today. Just a couple of logistical things. You've probably seen the restrooms as you come in by the foyer in case you need to have that. If you have a cell phone, if you could please put that on vibrate, we would appreciate that as well. I'd also like to recognize the planning group that helped to organize this event today, and that includes Donna Dickman, if you would stand, please. Dottie Kane, Kristen Shrimplin, Sharon Richardson, and Dr. Kenny Steinman, wherever he is there, Kenny, and Christine Mulvin, who's really worked to put all this together today, and Patty and Tara, our wonderful hostesses who helped get this together today too, so thank you to all of them. You can see that we have a very full agenda. We wanted to provide an opportunity for you all to learn as much as you can today about best and promising practices around family violence prevention. So you'll see that we had organized our events today to include a long listing of roundtable sessions. So you can see in your booklet there's a short description of those. But during the lunchtime, we'll have each one of those speakers come up and give you just a very brief tidbit of what they're going to be talking about. So that should help you in your selection of which roundtable you'd like to attend. And all of the roundtable rooms, there's one across the hall here, which is room 1. And the rest of them are all down this hallway here. And you'll see a sign outside the door that has the listing of the rooms. So look for that. And we'll talk more about that at lunchtime. I would like to introduce Cheryl Boyce. Cheryl is the chair of the HealthPath board. Cheryl is the retired director of the Ohio Commission on Minority Health, and she continues to work and has recently accepted a new opportunity to continue her good work as the director of advancement for the National Association of State Offices of Minority Health. Cheryl has provided outstanding leadership to HealthPath over the past 9 years and has had a key role in guiding our work in family violence prevention. Please join me in thanking Cheryl for her vision, her compassion, and leadership on behalf of those we are all here to serve. Cheryl?
Good morning. You have no idea how wonderful it is to look out and see all of you. I'm old enough that I can remember when violence prevention was not a public health issue. And I can remember my good friend, Dr. Deborah Prothero-Stith, defining it as such. And so we've come a long way in what seems like forever. And the fact that many of you have been laboring in the vineyards long before the system caught up with you in terms of the needs of the community, I think you should applaud yourselves. I want to recognize Shiloh Turner, who is the vice president for the Greater Cincinnati Foundation, and who serves as the leader for us in terms of her connectedness with the HealthPath Foundation. And I want to also, before I get into my remarks, thank Teresa. It must be very difficult to be one person and trying to cover 36 counties, but she does it admirably. As a testimony, all of you are here today, and she continues to extend the reach. HealthPath, I serve as the chair of the board for HealthPath, and so I bring you greetings on behalf of our board of directors. We have been really honored and humbled to be involved in this work. Many of you know that there was a time that we acted as though violence was inevitable in this country and in this state. And we only dealt with violence after the fact through the criminal justice system. The fact that we're looking at prevention strategies and believe that is not an inevitability, that people should be subjected to violence in our homes and our communities, means that we're making some progress. And so we're really pleased that you've come to this pre-conference meeting for the Community Connections Program. We look forward to extending the reach throughout the state. There have been so many people involved in this work over a number of years, and so I am going, and I left my glasses on the table, so I'm hoping that I will be able to see all of these, because I really don't want to overlook anyone. Everyone has played such a vital and important role. Thank you so much in this work. And so I'm going to ask some of our partners to stand and be acknowledged. Rebecca Klein of the Ohio Domestic Violence Network. Thank you. Donna Dickman. You know what? Stand up, because the work you do is so vital. You're going to get all the attention you can. We're going to stand until everybody's acknowledged, so please continue to stand. Donna Dickman of the Partnership for Violence-Free Families, a coalition in Allen County. Thank you. Dorothy Kane of the Tri-County Family Violence Prevention Coalition in Columbiana, Mahoning, and Trumbull counties. Thank you. Sharon Richardson from Violence Free Coalition of Warren County. Thank you, Sharon. Christian Smith Shrimplin of the Family Violence Prevention Project, a coalition in Hamilton County, Ohio. Joe Simpson of the Ohio Domestic Violence Network. She's probably in the garage trying to figure out how to get here. Someone who's been really involved in this work for a long time, Dr. Kenny Steinman, who led the Ohio Family Violence Prevention Project in collaboration with the Health Policy Institute of Ohio. And Dr. Steinman also wrote the white paper on improving family violence prevention in Ohio. Hi, Kenny. And the National Center for Adoption Law and Policy, who could not be with us today, but they are fulfilling a really vital role in all of this work, and we want to acknowledge them. Thank you very much for all you've done, and even more for all you're going to do. We want to thank our partners. We have provided more than $4 million in grants, and this is the next step on the journey. So we're looking forward to you continuing your work, but to joining us as we look at this vital issue. I want to, it always amazes me when people don't feel that they're personally affected by violence, that they don't see it as an issue that's important to them. So I want to share my favorite public health story with you. It's about a little mouse who's running around in a barnyard, and he finds out that there's a mouse trap that's been placed in the barnyard. So he goes to the cow and says, Miss Cow, there's a rat trap in the barnyard. And the cow says, I don't care, it's no interest to me. So the little dejected mouse goes off, and he goes to the pig and says, Mr. Pig, please help me. There's a rat trap in the barnyard. And the pig says, well, that's no interest to me. Why would you tell me about that? So the mouse goes off and finds the chicken. Says, chicken, please help me. There's this rat trap, and it's going to catch me. The chicken says, I really could care less. That's your business. I'll pray for you. So that night, in the dark silence of the farmhouse, the mouse trap snaps, and the farmer's wife goes to get the mouse and to throw it out. And as she reaches for it, she too late realizes that it's a venomous snake, and it bites her. And the farmer's wife dies, and there are so many people that want to come and express their sympathy that he has to slaughter the cow, the pig, and the chicken to feed them. So the next time that you see a mouse trap in the barnyard, you think it doesn't affect you, think about the mouse. And that's what I feel about violence, that whether people see that they're being affected by it or not, as long as it's in our homes and our community, there is a problem, and we need to address it. So think about the little mouse the next time somebody says, well, that's not my problem. Nobody I know is involved in violence. We all are. If one of us is, we all are. So I commend you on the work that you're doing. And so today what we're hoping is that you will tarry with us, that you will be energized and renewed. There are a number of projects that will be shared with you throughout the day showing promising practices in family violence prevention. And so I hope that you will get the information and that you will interact and feel free to ask questions. For tomorrow, we will all have to go back out in the barnyard, and there's work for us all to do. And so I would like to introduce you to Christian Smith-Shrimplin of the Family Violence Project, who will bring you some remarks and greetings. On behalf of the board, again, I wish you a wonderful day, and we look forward to continuing to labor in the vineyards with you.
Thank you, Cheryl. What a great way to start the morning. Before we hear about some of the exciting work going on in our Ohio counties, we want to share with you some ways that you can focus on family violence prevention in your own communities. It's going to be my pleasure to introduce Dr. Kenneth Steinman, who will be leading us in 2 general sessions today. The first will be making a compelling case for family violence prevention. Kenneth Steinman is an independent consultant who works with agencies and communities to write grants, conduct rigorous research and relevant research, and manage complex projects. He received his graduate training at the University of Michigan and has taught at the Hebrew University School of Public Health in Jerusalem and at the Ohio State University College of Public Health. He has authored many scholarly articles related to topics of family violence and has presented at dozens of conferences across the world over the past 20 years. Locally, he directed the Ohio Family Violence Prevention Project, a statewide initiative that aims to prevent child maltreatment, intimate partner violence, and elder abuse. In collaboration with the Health Policy Institute of Ohio, he authored a white paper on improving family violence prevention in Ohio. This document offers a blueprint for prevention efforts in our state and has been downloaded 15,000 times. Without further ado, here's Dr. Kenneth Steinman.
Right. Thanks, Kristen. Sounded good. Okay, let's give us good morning. Good morning. Okay, that's good. All right. We have, let me get this started here. Good, that's working. Am I mic'd up okay? Can you hear me? Terrific. Well, I'm going to move around a lot, and so over the weekend I saw with my boys Three Stooges, and so the fact that I and you are on camera right now makes us, let's not try to reenact that. Let's try to do something a little more, I don't know, productive and relevant. I do want to actually start, and I've said this before a number of times when I've talked to folks like you in Ohio, is that I've come to really appreciate what it is you do. I can't say I totally understand it. I don't appreciate it probably fully, but I really admire the type of work you do. And the fact that you're taking time out of your very important work to come here puts a high burden on me and on the other people here to make this worth your while. Because I know that everyone here, the folks, Teresa, Christian and others, recognize how important the work it is you're doing, and so we want to make today as productive as possible. And I think it's worthwhile, and I hope you find when you leave today that it has indeed been so. So let me start with that. On the flip side, it'd be unfair for me or us to ask you to come if we're not willing to come out to you as well. And so I'll just preface my remarks from saying, please, 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 if you find something that I'm saying helpful, don't hesitate to contact me and say, hey, can I come up to Hardin County? Would you come down to Claremont? I'm interested in doing that. Yes, I'm a consultant, but I'm happy to do it for free, maybe a little travel, whatever. But please keep that in mind if what you're finding to be helpful. It doesn't hurt to ask. I can't absolutely honor every request, but I really will try to do so. So hopefully that'll start us off in that you've given me your time today. I'm happy to reciprocate as well. So let's get started. How do we make a compelling case for family violence prevention? First, and we'll talk about this in the afternoon, objectives. It's important to be very clear what we're trying to do. And so in the next hour and 10 minutes or so, they've asked me, and I'm going to try to make it possible so by the end of the session, every single person in this room should be able to describe the spectrum of prevention, whatever that is. Some of you may know already. Describe 3 principles for making a compelling case for family violence prevention. And every person in this room should be able to access and use data on family violence for grant writing. That's what we're going to do. The second to last slide in this presentation is this exact same slide. And so hopefully we'll be able to revisit whether or not we've indeed met those objectives. Anyone in the wrong session? Okay. Okay, let's go. All right, so here's where we're going. We're going to talk about framing prevention, framing the problem, whatever that might be. Obviously, family violence is very diverse and complex. How do we frame a problem? And then sort of what are family violence data? Why don't we use them? Why bother? What exactly are these data? And how should we use them? Once I convince you that we should bother using them, how do we use them? And then, of course, questions and answers. So let's start with framing prevention. Why is prevention a hard sell? Why is it hard? You've all tried to get money for this work. You're trying to get money right now. Why is it a hard sell? Why is it hard to convince people prevention's worthwhile? Yes? It's hard to prove it's effective. Yep. Other? Yes? It requires a shift in thinking. Okay, what kind of shift?
From a reactive frame of mind to a proactive.
So we're not just reacting to the problem, we're trying to proactively anticipate it and address it before it begins. Good. Yes? Yes, they have no problem that needs preventing. Excellent. These are great ideas, and actually I've tried to summarize things that everyone should nod. Yeah, that makes sense. That makes sense. And sort of apropos of what you just said, when prevention works, nothing happens. And so it's very easy to lose sight of what we're doing. If we take our foot off the gas and we're working and preventing this problem and we take our foot off the gas, guess what? The problem often reemerges. But while we have our foot on the gas, we're just cruising down the highway. Everyone thinks, oh, this is fine. We don't need to continue invest in keeping someone's foot on the gas. So prevention can be hard because it's hard to show that it works. And not that intervention is easy, believe me, by any means, but you can point to someone who, let's say, has had their life changed by a program. But you can't say, you see that child there who's now graduating, valedictorian from her high school? Had we not had her prevention program, she would have gotten into a violent relationship and dropped out of school. We don't know. We can't do it. But we nonetheless have safe dates, and who knows how many people that's affected. We can, from a quantitative perspective, try to prove these work or show that but it can be hard, absolutely. But what's frustrating is that we can tell stories about intervention a lot more easily than we can tell stories about prevention. And so that's one of the challenges we face when trying to make a case for prevention. The other, another challenge is what's known as the prevention paradox. Anyone ever heard of this? Okay. Go to grad school. This is worthwhile. This is one thing I've taught this a number of times. That at the individual level, the costs associated with the prevention often far outweigh for the individual the benefits. So for instance, anyone here ride a bicycle? Yeah. Okay, right, come on. How many of you wear a helmet? I do too. I ride a bike, wear a helmet. How many of you have ever been in an accident where your helmet prevented you from getting a head injury? Okay, good, 2. Okay, we have 2. I never have. My father's been riding his bike to work in Boston for 40 years. Been hit twice. Helmet didn't help either time. He's fine. He wasn't hurt, don't worry. But once every 20 years, you get, Boston drivers, it happens. He's been wearing a helmet every single day. That helmet, who knows how many helmets he's gone through. It's cost money. You think my hair looks funny, you should see his. So he's had some real costs associated with it, yet never once has he as an individual benefited from wearing a helmet all these years. Some people here have. And so one of the challenges is that for an individual, he's had real costs associated with this preventive activity and hasn't had any benefits whatsoever. I've been riding a bike for probably 40 years, not as daily as he, worn a helmet almost all the time. Never once had a crash where a helmet helped me. And so the costs associated with that preventive activity, for me, really outweigh any benefits I've ever had. Similarly, we have, yet at the societal level, if we really encourage people to wear helmets, if we really have laws like that kids under 16 have to wear a helmet when they're riding a bike, things like that, at the societal level, absolutely it makes sense. Because we know there were a couple hands that went up. Most hands didn't, but a couple hands did. And the costs associated with that, preventing those head injuries are far, the benefits, that is the cost savings we have, far outweigh the costs for the rest of us in terms of, crummy hair and paying for helmets. And so that's one of the paradoxes of prevention, that for the individual, the costs really outweigh the benefits, but for society, often the benefits outweigh the costs. And it's sometimes hard to convince people to do these preventive acts when at the individual level it doesn't really seem to benefit them, even though we know from the broader perspective it does. The other challenge of why prevention's a hard sell is, yes, it costs money, but we also know it saves money. And so, but what often happens is that one person is paying for the prevention and another community agency is reaping the benefits. So somebody pays for safe dates, somebody pays for Donna to do safe dates, and they do it and it works, and it's wonderful, and meanwhile that girl's moved on and she has now graduating, is now a young woman, and she's graduating from a different community, a different high school, and a whole different group of people are going to be benefiting from her having had safe dates. And so one of the challenges of prevention, and a lot of people who are in policy-making decisions wrestle with this, is why should I pay money because I'm not going to recoup it? Now, from the broader societal perspective, yes, as a society we invest money and we, ounce of prevention is worth a pound of cure, absolutely. But for the individual, it's often that somebody pays for prevention and the benefits associated with that accrue to somebody else. So I don't have an easy answer for that. I don't know from a political perspective how we make a case for people who have a particularly narrow focus to invest in prevention. But that's a real challenge that we do have to acknowledge. So everyone ready? So we're not going to do family violence prevention. Okay? I'm joking, because and yet, why should we still do it? Well, it's still often easier than intervention. You all know how complex and difficult it is to intervene in a violent situation. With a person who's a victim, with a person who's a perpetrator. People who in their lifespan may have been both. And so preventing it often is easier than intervening. It may be less political. A lot of, who's against, who wants to avoid preventing domestic disputes or elder abuse? Of course, we want to all prevent it, but in terms of how we intervene, that becomes much more challenging, political. Also, most of our agencies, as we talk about shifting from reacting to problem, most of our agencies are organized to react. So we have child protective services, adult protective services. We have agencies that are positioned to respond. We don't have many agencies through government that are intended to prevent problems, which is at some level a blessing in that more agencies, a wider range of folks at the local and state and federal level might be considered to be involved in family violence prevention. And one of the themes of the white paper that we're trying to do is spread the recognition that who's doing family violence prevention. People involved in substance abuse treatment are doing family violence prevention, whether they know it or not. And so many other folks, other agencies, other offices, other efforts are involved in communities, are involved in family violence prevention, whether they recognize it or not. One of the goals we're trying to do more broadly is to get people to recognize that what they're doing is family violence prevention. It can be cost effective, not always, but it can be cost effective and it be difficult to show, both in terms of ounce of prevention worth a pound of cure, but also in terms of economies of scale. It's easier to replicate successful prevention programs often than it is successful intervention programs. The requirements in terms of skilled staff and institutional investment tend to be a bit less, and so it's easier to bring effective prevention efforts to scale compared to with intervention. And lastly, and this is a theme Teresa, I think, has been very good at articulating over and over, it can work. one of our goals that we need to be out to convince ourselves and to convince everyone, prevention can work. It's hard to show it does. It really is, but it can work. And so part of what we need to do is be able to make that case for a compelling case for prevention, family violence. So anyone ever heard of the spectrum of prevention? Let's see, hands. Okay, more people wear a helmet riding a bike. Okay, that's good. So Rebecca, I know you know, so you could be up here doing it. In terms of thinking about prevention as a spectrum, part of this came out of, it's actually initially done in the area of developmental disabilities and how to address that. We had, and it recognizes that prevention is more than teaching about healthy behaviors. Neither Cheryl nor I are old enough to remember when public health was not just, violence wasn't a public health issue, behavior wasn't even a public health issue. And actually last week, Lester Breslow, who is UCLA, a former dean, was one of the people who originally helped recognize that public health is more than communicable disease, that smoking, that diet, exercise, and eventually violence are real public health issues. And that he made a very articulate, it was one of the leaders of this idea of expanding how we think of public health. He just passed away at a ripe old age. So, but similarly, prevention, we're still working on that, but now we're almost going backwards and saying it's not just teaching about healthy behaviors. We're not just encouraging people to wear a helmet or to recognize, question gender stereotypes in their own lives and in how they anticipate a relationship, what they expect out of a relationship. But we need to think about broader ways in which what we're doing can help prevent the problems we're concerned with. Recognizing that prevention occurs at multiple complementary levels. Intervening at any one level or working at any one level is insufficient, and we need to recognize who else around the table is doing family violence prevention, who else is involved in the same type of work we're doing. And to recognize these different levels and to think about at each level what might be some of the most important efforts we should invest in. And I know the HealthPath Foundation's been I really admire them for being one of the few sources that has a specific focus on family violence prevention. And that's unusual and I think really worthwhile to think, and we can maybe, Teresa, I'm gonna put you on the spot later to talk about how you work at these different levels. So I'm gonna ask you in a couple slides, start thinking now, how might these different levels of prevention apply to family violence? So I'm going to give an example of smoking, but I'm going to come back to you and think about how might this apply to family violence. Isn't that pretty? Yeah, that took me like an hour. I knew PowerPoint like 1993 like really well, or 97, whatever. Now I just got the new Windows 7 and it's so anyways. But for you, it was worth it. Okay, so we talk about different levels of influencing of prevention, from influencing policy and legislation, you can all think of, to everything from taxes to mandating certain types of programming in schools, to changing organizational practices, perhaps issuing an executive order like Governor Strickland did around domestic violence, to fostering coalitions and networks. That sound familiar? Anyone here involved in too many coalition meetings? Yes. We still go to them. It must be worthwhile. People are doing it. So, but that's really absolutely part of prevention. To educating providers. So when you're in an emergency room, hospital emergency room, how do you handle someone who, young woman who comes in with an orbital fracture? You know, what might be some ways in which to help intervene successfully? To promoting community education. What are ways in which we can work at the broad level through media campaigns, through to work at the community level, and then finally, where we sort of started, and yes, indeed, working with individuals on developing their own and strengthening their own individual knowledge and skills in this area. So let me give a couple of examples from the smoking world. How much does a pack of cigarettes cost us? $6? You knew that pretty quickly. Just like that. All right. Yeah, in New York, it's about $11. Now, this is a little old. 11, wow, it's almost twice. And I know New York's expensive, but trust me, it's even more, if you go to New Jersey, it's a lot cheaper. Why? Because Mayor Bloomberg, who's very into public health, what's the name of the School of Public Health at Johns Hopkins University? All right. Charm City, crab cakes. All right. So my mom was born in Baltimore. I was born in D.C. So that's how much a pack of cigarettes cost. I don't know why, Pall Mall is more expensive than, I don't know, it's Newport or whatever. But it's expensive. Why is it expensive? Because they purposefully passed taxes. They tried to influence legislation, and they made it very high, very expensive to purchase a pack of cigarettes. Now, of course, lots of people are going to New Jersey to buy their cigarettes or going out to city limits, but not so much teenagers. If you're 15 years old and you want to smoke cigarettes, it's kind of hard to get cigarettes now. You can't as easily, take one of the, you could take community, but it's a hassle. So youth smoking in New York has plummeted since a few years ago. They made this taxes. Lots of other cities have also instituted taxes on cigarettes for the same reason. Not that it's targeting adult smokers, it's targeting children smokers. Changing organizational practices. Anyone remember smoking on a plane? Yeah, not snakes on a plane, cigarettes on a plane. Right. And so similarly, a lot of companies said no more smoking. So welcome to Marlboro country. You can now, stand outside the exit and cough with your colleagues. So that's become another way to influence to prevent smoking. There's it's a billboard of a tobacco executive in a bikini. No wonder tobacco executives hide behind sexy models. This is from the Truth Campaign. It's been very effective in helping, especially focusing on young people, helping them think about and question and present big tobacco as an enemy, someone you want to rebel against. Don't let them convince you to smoke. Be a rebel. And it's been very effective and continues to this day. Promoting community education. And also strengthening individual knowledge and skills. So a number of states still have quit lines. Ohio's is sort of holding on by a thread. But again, that's still part of prevention, helping people quit. So I asked you a question before. Now it's time for you to respond. Oh, sorry. So I'm sorry. So this actually works. Just in the last 15 years. I know, yeah, people used to smoke a lot in the 60s, and it's been going down since. But even the last 15 years, there's been nearly a 40% reduction in how much people smoke daily. 1995, about 1 in 5 adults were smoking. 2010, I think, it's down to 12.4%. That's huge. That's huge. And so now, here's the question. So how does this apply to family violence? Can you give me an example of how your work or others of your colleagues' work has helped influence policies and legislation around preventing different types of family violence in Ohio? Yes? Okay. Great. Okay. How did that come about? What did you actually do? Okay, so it's often individuals and advocates who are doing public health or in this case, family violence prevention. So it's not just people intervening professionals, but also advocates who are working in that area with a personal connection. Other ways in which, can you think of other examples of how, yeah, Sharon?
Sexting legislation.
Sexting legislation, okay.
Young people were being charged as, sexual predators.
Oh, yes.
For the rest of their lives, and that was just too harsh for that. So
right.
legislation came about to lessen that and cut back on it, although it's not. But,
yeah, but
it's less of a crime now.
Right, and recognizing that, it's probably ineffective as a deterrent, and yet, as we all know, some people who get involved in the criminal justice system, it's not like that's helping them. I mean, it can absolutely devastate an individual family if they, depending on how they get involved. Is there a hand up over there? Can you think of other ways, other levels? Yeah, Deb? Uh-huh. Okay, good. So community education. And again, how did that come about? Like, was there, I'm not sure who was behind it, but that person's doing family violence prevention, whether they recognize it or not. And we need to also be comfortable broadening our understanding of it. And so that might be, promoting community education. Yes? I'm sorry, the example of the new movie Bully, the documentary Bully that has just come out. That person, the director and the people promoting that are doing family violence prevention, even if they don't think of it as that way, or even if we haven't thought about it that way. Other examples of ways in which we're working at this? Yes, in the back, and then Dottie next. Excellent. So, where is that? In Warren County. In Warren County? Okay. Why aren't you sitting with Sharon? I don't want to start over the pole. Okay, fair enough.
She's leaving us some role, I think.
Good. So that could be maybe an educating. That could be an educating providers in that area. Yes, and Dottie.
Changing organizational practices.
Uh-huh.
The work that our coalition is engaged in is changing the way workplaces address domestic violence. And
Yeah.
I just got an email yesterday that the federal government now, every department and agency has to have policies supportive of victims of domestic violence and addressing perpetrators.
Wow. Okay, so I'm sorry, I'll try to repeat. Yep, keep on nagging. That's fine. So that there are different federal government agencies now have to have policies that support victims of domestic violence, and so that's absolutely changing organizational practices around this. There's another hand. Oh, yes.
I work in a school. I'm a counselor in the junior high, and we have to assume all schools in the mandatory proactive programs regarding bullying, violence, suicide, school violence, and mandatory ways that we now document and keep track of incidents.
Excellent. So within schools, there are now guidelines and regulations regarding how you're supposed to track and respond to incidences of bullying. Again, that's changing organizational practices, perhaps educating providers, depending on what a teacher's supposed to do. And I don't know in terms of education whether that, I don't know if that's mandated, not, or yet.
If it's mandated, but it's something that I can change, like on the website where parents or community members can go on and report bullying incidences that they've heard about. If they want to be anonymous, like I know on our website we have.
Yeah. Good. Okay, excellent. So here's the take. I'm gonna keep going, but I owe you. Okay. Okay. You can ask 2 questions later. So 3 things just to remember about the spectrum of prevention: that it's beyond teaching about behaviors, trying to influence that. It works at multiple levels, and that they're complementary. Where is it? This happened not because of taxes, not because of specific education programs or media campaigns, but because of our businesses changing their no smoking policies, but because of all of them. And so often, and I got a little frustrated in academia sometimes when our sort of model of change is that, well, what we really need is we need evidence-based practices, which are true, and they absolutely have a role, and we'll talk about them a lot today, but that it's not because this didn't happen because every single person was exposed to an evidence-based program, and therefore they changed their behavior, and therefore we had this huge reduction. It's because of the breadth of these efforts in addition to the quality of some of them. And so that's what I really want to emphasize, that prevention for family violence really is about these multiple layers of efforts, and to recognize how your work fits in, and to think about within your community where you are and who else is doing what, and who might be some potential allies to recognize those relationships. That's the spectrum of prevention. Learning objective 1. Click. All right. We together? All right. We'll come back. This is on the test. Okay, so we've framed prevention. Now let's frame the problem. And here, 3 principles. You're going to hear them a lot. The 3 C's. We need to, first, at some level, consider to what extent the problem, whatever it is, child maltreatment or child sexual abuse or human trafficking or elder neglect or whatever the problem is, how we're going to frame that, to what extent is it common? To what extent is it consequential? To what extent is it changeable? 3 C's. Keep those in mind. And we want to think about that because if it's not, and that's okay if it's not, that's going to limit our ability to make a case for it. I mentioned human trafficking. A lot of publicity recently, Kasich's, gotten bug in his ear, and I know a number of people have been working in it. I also know that there is some skepticism about exactly how common it is. Not that it's not a huge problem and tremendously consequential and that it does happen, but how common it is. There's been some, I was at academic talk where they worked with agencies around the state of Ohio and in Michigan, and they tried to do a thorough as possible job of documenting every possible case that might have had something to do with human trafficking over the last 10 years, and they came up with like 15 cases, which, are real, it's there, but there was some sort of, and a lot of people were really interested in the topic, and we were there, but there was also sort of well, that's it. There's it's not more common, so even in a very expansive definition. So I know that there's a number of issues batted around, so there's some question, and this is what limits people's ability to work in this area. You need to convince policymakers that it is indeed common. You need to also think about, is it really as common as we think it is? So that's what we're going to need to be able to do, and that's where we're headed. Once we agree, once we ourselves are convinced that it is indeed common, whatever the problem is we're addressing, consequential and changeable, then we need to show. And that's what we're going to talk about today. How can we show? And we're all here because we care about family violence, because we think it's common, consequential, and changeable. Prevention can work. The family violence is devastating. It is common. But how do we show other people that it's common, consequential, and changeable? There's 2 ways. And John McKnight, anyone ever heard of him? He was in Chicago. It was real, yeah, you're nodding. So great, I think social work was his background, I'm not sure. But really, I've always admired him. Said that communities learn from stories. Policymakers are motivated by stories. Policymakers are motivated by studies. So there's 2 ways we can show that family violence is common, consequential, and changeable. One is through stories. I'm sure everyone here who's trying to work with someone has gotten them and said, every day I see women come into our shelter or my practice, who are experiencing this. And so you can tell a story about how common it is. Does anyone have an example of how they often tell stories about how common a particular problem is? All right, we'll think about it. I'll come back. Consequential. Often, we've been in situations where for legislation, for House Bill 19, individuals who have experienced, let's say, dating violence had got up and said, this is what happened to me. This is how devastating. I lost my childhood. I nearly died. Or my daughter was murdered. So we can learn through stories about the consequences of family violence. And lastly, that it's changeable. I mentioned before it's hard, impossible often, to show that a particular prevention program, prevented somebody from initiating some harm. But that certainly for intervention, and there's obviously some of a blend between the two, that this program saved my life. Was it not for this program? Here's a story that tells you that yes, these efforts are important, that they are changeable. It doesn't have to be this way. And so stories are powerful, and I want to encourage you to use them, but that's not what I'm here to talk about. You know them already. You probably do a very good job of being able to tell them. What I want to think about is data and studies. How can studies be used to show that family violence is common, consequential, and changeable? Back to smoking. Don't worry, I'm not going to do much more on smoking. So, I mentioned 1995, 1 in 5, that's sort of what 1 in 5 looks like. Everybody's happy, but everyone read is smoking, or a daily smoker. that it can be, and it was seen as common. That was never a concern to people. You didn't have to convince people that, like you do with family violence. Family violence is common. Many people don't recognize that. Smoking, they do. They're able to show through studies it's consequential. This is from a famous article in the Journal of American Medical Association from 1993. Shows the actual cause. It was titled "The Actual Causes of Death in the U.S." and using some sophisticated methodology. Long story short, looked at non-genetic causes of death. What's really behind all the different causes of death? And I'm sorry if you can't see it, but there's about a third of deaths are attributable to tobacco. About a quarter to diet and activity patterns, some to alcohol, microbial agents, toxic, etc. So this shows, yes, wow, 1/3 of all deaths. The leading cause of death in the US, tobacco. They've actually tried to update this, and people question methodology, so the more recent one's actually been kind of cast aside. But long story short, this is still largely true. And this was very important, helping motivate people to recognize the importance of tobacco as a public health issue. Lastly, was smoking changeable? Well, yeah, we started to get these studies. In terms of using data, studies. So people would study whether smoking bans are indeed linked to certain outcomes. And yes, wow, when they've done a couple of things like Montana, for instance, passed a smoking ban, and then it was rescinded. Something happened in the legislature, whatever. But in the few months where it was enacted, heart attacks dropped markedly in Montana, and they could document that. And then once the smoking ban was reversed, it went back up. So you can actually, it's a nice little natural experiment to say, oh my goodness, look at this. This actually is making a difference. Similarly, cigarette taxes in youth. You can actually follow how much youth are saying they're smoking, what the taxes are, and how that plays out. Tobacco quit lines, do they work? If not, so through program evaluation, through some surveillance, we can begin to get a sense of, yeah, we can actually do something. It's not just a problem that's unfixable. And so that's what's really motivated with smoking. Now with family violence, how can we show family violence is common, consequential, and changeable? Well, as you know, it's a more difficult issue to study. People will tell you in a survey whether or not they smoke. They're a lot less likely to tell you whether they're in a violent relationship or whether they're a perpetrator. They will to some degree. And there's problems with the research, but that I think, and it's worth doing, and I do it, but I recognize it's more complex to study than smoking. But we need to be able to use data in order to show that it's common, consequential, and changeable. Now we're going to do so. That's what we're going to do. So what are family violence data? Pet peeve of mine, number 37, data are plural. Not the data is, the data shows. The data show. There's data. So, sorry, okay. Got to get that off my chest. What are family violence data? That's why I said are. Quantifiable information about the risk factors for, the scope of, and the consequences of family violence. That's what we're going to talk about. And here's a very simple graph. Now, we'll talk about this later. I know. Family violence is very complex. It's cyclical, and there's many, many factors involved. And this is a very simplistic diagram. But I think it is still helpful to suggest that we're interested in measuring what we might call contributing factors. Some people call them risk factors that influence family violence, that themselves are associated one with the other. And that family violence, there's also consequences associated with it. Unfortunately, and I'm sure you've experienced this firsthand, a lot of policymakers don't care as much about family violence